Okay. Welcome to the first meeting of the Health and Wellbeing Board for this municipal year and the first remote board meeting. Just to remind you all, this will be live streamed, recorded and uploaded onto YouTube. I'm Councillor Kelly Middleton, the Chair. If the board members would like to introduce themselves.
In what order?
Well, I'm looking at my screen, yeah, so start with Paul.
Hi, I'm Councillor Paul Watling. I'm the lead member for Communities and Cooperative Council at Telford Wrekin Council.
Andy.
Councillor Andy Burford. I'm the Cabinet Member for Health and Social Care and Ward Member for Dawley and Aqueduct.
Joe.
Jo Leahy, Clinical Chair, Telford Wrekin CCG and Vice Chair of the Health and Wellbeing Board.
Karen Tomlinson, Councillor for Dot Hill Ward.
Karen.
Hi, I'm Caro Hart. I'm the CEO of the Citizens Advice Telford Wrekin and the voluntary sector representative by virtue of being the chair of COG, which is creating a stronger voice for the voluntary sector.
Richard.
Hello, I'm Councillor Richard Overton. I'm the Deputy Lead and Cabinet Member for Enforcement, Community Safety and Customer Services.
Jonathan.
Sorry, Chair. I'm Jonathan Rowe, Executive Director for Adult Social Care, Health and Wellbeing at Telford Wrekin Council.
Dave.
I'm Dave Evans. I'm the Joint Accountable Officer for Shropshire CCG and Telford and Wrekin CCG. And apologies, Kelly, but I can only be here for about half an hour this morning.
No problem. Thank you. Liz.
I am Liz Noakes, Director of Public Health for Telford Wrekin Council.
Ian.
Councillor Ian Fletcher, Prisley Ward.
Okay. Anybody else need to? I can't see everybody.
You've got Clive Jones, Executive Director, Children and Family Services, Telford Wrekin Council.
Thank you.
And Sarah Dillon, Director of Adult Social Care, Telford and Wrekin Council.
Thank you. Is that everybody? Yeah. Okay, I propose some changes to the agenda today. We're going to have a minute's silence and then we're going to take item 5 so Dave Evans can present a report to the meeting and then we'll revert back to the agenda. Everybody's happy with that? So we're going to observe a minute's silence to remember those who've been affected by COVID-19. Thank you. So just some arrangements for the meeting. If you're not presenting, can you please put yourselves on mute? If you are presenting, then it's 5 minutes for each presentation, and then we'll take questions and discussion after. And if you'd like to indicate you want to speak, if you can put your virtual hand up and I'll make a note. So just before we start agenda number 5, item 5, Is there any declarations of interest on that item? Take that as a no. Okay, Dave, thank you.
Thanks, Kelly. So we submitted a presentation which I will endeavour to put on the screen now for board members, if I can. Just give me a second. Was here a moment ago, but appears to have disappeared for a second. I'll just go back and find it, so apologies for that. So I wanted to talk today particularly about the restoration and recovery of services following COVID. I suppose the first thing I would say is this is going to be quite challenging in terms of some of the issues that we need to deal with don't mean that we will get back to normal in any normal sense of what activity looked like prior to the start of COVID. And there are a number of factors associated with that. Those include things like social distancing and how we make sure that we comply with social distancing in hospital settings, for example. They also mean around the discharge arrangements for patients in terms of patients being discharged from hospital appropriately, so that we can make sure that patients are discharged and are discharged with the guidance in mind. That means that someone self-isolates for 14 days before they then are put into another type of care setting. Now, clearly, that presents challenges around community hospital capacity and care home capacity. And also looking at how we bring back elective capacity in terms of what that will mean, again, for patients who have to self-isolate at home for 14 days before they come into hospital. What I would let Health and Wellbeing Board know is, of course, all of this is also compounded. I am struggling to get the presentation up, Kelly, I'm sorry. It's apologies for that, but I will talk it through. What I would like Health and Wellbeing Board to be made aware of is all of this, of course, is also reliant on the availability of personal and protective equipment for staff and carers across all sectors. And clearly there continue to be some challenges in supply at a national and regional and local level. And that is going to be one of the constricting factors, along with staff, for our ability to resource services. So when I talk about restoration and recovery, I do want to counsel that with the notion that we won't necessarily be looking at, for some considerable time, getting services back to the same levels of activity as they were before. And if I just put that into context, although we're looking at mitigations at the moment, if you just think about it in things like MRI scanners, for example, they will now have to be fully cleaned between each patient going into them to prevent cross-contamination and prevent infection control, or make sure that infection control measures are in place. That seriously restricts the capacity of diagnostics, although we are looking at mobiles. So if I just quickly flick through the presentation, because I thought it was important to contextualise those. We do want to make sure that as we go through, we move to some kind of new normal. So we are beginning to restore services. We were set nationally, the NHS was set a target of a range of services called essential services to be restored by the 15th of June. We are on target to meet that. Will meet that. Nonetheless, that won't necessarily be to the capacity that was there before because of all of those other constraints I've just talked about. As a system, we've agreed that in terms of bringing services back, we want there to be 8 tests that are met to make sure that both the services are safe to bring back, but also that we encompass where innovations happened during the COVID period. We make sure that we embed that as part of the new normal, for want of a better word, in terms of how services come back. If people wanted to move on to slide 4, the principles and expectations of the system are set out there. Again, I'm not going to go over those in detail, but happy to take questions of those. The vision on slide 5 is lifted from the draft long-term plan for the Shropshire Telford and Wrekin system, and it is about starting well, living well and aging well, and making sure that in terms of the different areas we talk about people, places and partnerships to support wellbeing, we move up through integrated and joined up community-based services, and we have high quality care across a 7-day week. Slide 6 in a sense is a reproduction of slide 4, but the thing I wanted to flag there was innovation. There have been a number of things that have happened through COVID, not least of us doing things like meetings on Teams, but in particular, I would never have thought we could have got all GP practices across Telford and Wrekin doing telephone triage. Within the space of time, we managed to achieve that. A lot of consultations with other staff across the system, including acute, are being done by telephone or by video consultation. We've seen reductions in activity. We've seen an increase in community-based activity and patients being looked after or cared for closer to home or at home. We need to make sure that we continue with those as we move forward. We want to make sure that we capture that through a triple lens, which is highlighted on slide 7. We have got some information gathering that we want to make sure we pick up in terms of learning about the impact of changes moving forward and making sure we assimilate those into our restoration funds. And just finally, the last slide I was going to particularly look at was the governance arrangements in place. One of the advantages I think that we've seen this system develop as we've worked through our response to COVID-19 is a very joined up system response. The systems work much more collectively and collegiately. We've had genuine collaborative decision making through our governance structure in a way that I've not seen in this system in the 8 years I've been here. I want to make sure that we carry that forward as part of where we go. And then just finally, in terms of key risks, I've already highlighted some of these at the beginning of the presentation, but we know in terms of getting back to full capacity, they're going to be the real challenges for us. So that was a real whistle stop, Kelly, just to keep this down to about 5 minutes, but happy to take questions.
Thank you. I've got at the moment 4 hands up, so I'll do them in order of when I saw them. So Rich, Councillor Overton.
Yeah, thank you, David, for that presentation. I mean, it's really key that we take some learning from how the system has changed through the way we've dealt with patients. And I just want to understand the accident emergency department, because I know that they've had a reduction in the number of people going there, and some of that is positive because some people go to A&E who don't need to go, but there's also the negative that some people haven't gone because they were scared of going who needed to go. And I just wonder how we as a system get that right for the future, that we make sure those people don't need to go, don't go there, but also we encourage those people, you know, although this is going to go on for a bit, that they need to get health care if they're having heart attacks or strokes, etc., and not sit at home thinking it's just something, a hot flush or something. And secondly, the care sector. I mean, the care sector is very important. I mean, luckily in Telford Wrekin, we've worked well with the care sector in relation to COVID, but I'm just wondering in the future if there is a second wave, or if the pandemic, is going to be, because until we get a vaccine, we never know what's going to happen, how we work closer with the care sector. I mean, there was a programme on last night where a care home in Birmingham actually has a section in its own care home for isolation. So people coming from hospital are put in that section away from the other residents, still getting the same care, only a few carers who deal with that. And that what means people leave hospital, but they also don't infect the rest of the care home in case they have it.
Thanks, Richard. So if I pick those up in turn, I mean, clearly we saw a significant drop-off in A&E activity, as the rest of the country did. I mean, at times we were at least 50% down in levels of activity. And you're right, there were 2 categories. There were those groups of patients who perhaps could have always accessed other services, and we need to try and make sure we change the messaging around that sector of the population in the future, will they continue with those behaviours to take pressure away from the A&E department? So whatever they were doing during COVID, please carry that on, and there is a plan in place to do exactly that. But there is that group of patients who, I think clearly, if you looked at stroke and heart attack levels across the country, where there was a significant reduction, some of which actually isn't easily explained, I have to say, but nonetheless it is inevitable. There were some patients who were put off going to A&E because they were worried about getting COVID. We've been really clear over the last 3 or 4 weeks now that the NHS is open for business. We are seeing a gradual rebalancing, is probably how I would best describe it. Primary care has picked up over the last 3 or 4 weeks and is getting busier, particularly since the last bank holiday weekend. And similarly, the 2 A&E departments have got busier over the past 3 or 4 weeks, but not to the extent they were before, I'm pleased to say. So we're really clear that we want to get the messaging right, both around attending A&E if you need to, via 999 or 111 if that's the right source, but also about making sure that we get the messaging right about other types of services in place for population who don't need to use A&E. In turn to care homes, we have been having those discussions with the care sector because the guidance came out about patients have got to be tested before discharge and self-isolate for 14 days. Now, clearly, for a lot of patients going home, that's less of a challenge. But for those patients who require ongoing care, that has presented some challenge for this system. We have been working with care homes. For those areas that can, they have been looking at setting up separate wings so that they could take patients back into those. The one group of patients where it is slightly more complex and difficult, and we've got a paper coming back to chief executives tomorrow to look at how we can again look at this, are patients with dementia who are prone to wandering, because even if you've got a separate wing in a care home, a patient with dementia may well wander out of that wing because they just don't understand what they're doing and potentially cross-infect other patients. So dementia we are still looking at. Other areas we have made progress on. I have no doubt we are going to see a recurrence in terms of prevalence rate at some point over the next 5 or 6 months.
Councillor Watling.
Hi, David. Thank you for your presentation. And yes, I'd like to echo your comments about the way the sector and the council have worked together in this crisis. It has been positive to see. There's a couple of questions. First one is just around deaths in care homes. We've seen a lower percentage of deaths in care homes in Telford and Wrekin to others, and I'd like to understand that a bit and understand why that's happened, and if you've got any comments on that, that would be welcome. The second one is the point you made about the re-looking at the way that we work in the future. I think we have to learn from what's happened. We've seen some amazing work in the communities across Telford and Wrekin. That means us working together in terms of budgets, etc., for that, because that doesn't happen without the support of both the health sector and the council. And what I'd like is a commitment that we will work together on re-looking at how we offer those services across across Telford and Wrekin, and work together on the best way to do that. We've got some really good partnerships already in Telford and Wrekin. How do we get more partnerships? How do we get more working together across the whole of the borough? Thank you.
Thanks, Paul. Your first question, to be honest, I haven't got an answer for. Liz may have some ideas in terms of why we've seen lower rates of death in care homes in Telford than in other areas, but there's no obvious answer that strikes. But as I say, Liz may want to come in on that. In relation to your second point, though, I'm absolutely committed, as the CCG is, to making sure that we both build on what's gone well in COVID, make sure we learn from the bits that maybe haven't gone quite so well, and that's always the case. but we're absolutely committed to developing further locality, neighbourhood-based models of care, working with local authority and other partner organisations, including primary care, to make sure that we both take a shorter-term view around how we prevent people going into hospital now, but also take a much more coordinated, joined-up approach to short, medium and long-term prevention of ill health for our population.
Liz, did you want to comment on that?
Yes, I'll come in on that. In terms of numbers of deaths in care homes, we're probably just slightly beneath the West Midland average in terms of that. So that is the position. David's right in terms of absolutely not having. We haven't investigated that necessarily why, but I would make 3 points really. First of all, the measures taken by the care homes themselves, they have been on the front line from the beginning, and the measures they have taken in terms of closing to admissions, staffing, all those issues that they have taken themselves right from the beginning must be applauded. Secondly, I think we have had a proactive approach in terms of supporting the care homes from a preventative point of view. So not just those that are being subject to outbreaks, which does happen from time to time. This is what this situation inevitably, but not only just supporting those in outbreaks, often led by Public Health England, but preventing outbreaks themselves through a proactive approach with the others. And then I think also a measured approach to discharges, which is what Richard was really asking around as well. So we're not out of the woods yet, as David has described, but all those approaches are things that we need to keep up with. But I think my first point in terms of the measures taken by care homes themselves must be applauded.
I would echo that, Liz. Sorry, I should have said that.
Councillor Burford.
Yes, thanks, Kelly. Thanks for the presentation, David, and thanks also for the commitment to, which I think I heard you say, to Paul's question, to step up our community and neighbourhood working, which is already in some areas effective. I think a big step change in that direction would be just what we need going forward. On the innovations, and you obviously mentioned digital approaches and how GP practices have got on board with that, and how encouraging that has been through the pandemic. I mean, can we see perhaps at another meeting some detail around how those innovations, not just digital, but that will be a central part, how those innovations are going to take place, a timeline for them, the kind of big initiatives that we know are possible if we all pull together on this. And on the same level, I'd just like to see, the paper you presented is quite high level. I'd like to see the detail in the future of the individual pathways and how they're going to operate differently to now, and also some of the big ideas that we've got. There are opportunities, I think, to be much more radical than just getting back to normal and with a few tweaks. And I think one example of that, and Richard raised care homes, beyond COVID, we've got to find a way of getting more NHS presence in care homes, so that we're able to manage a population which has got, as it has in recent years, more infirm within care homes, because we're taking those who are really at the top end of needs, and that there needs to be an NHS presence within those homes, and much better collaboration between those homes and the health service. So there's a number of points buried in there, but I mean, I'll welcome any comments you've got, David.
Thanks, Andy. I mean, certainly in terms of the plan, happy to bring that back in more detail at another day, or specifics around the plan, including digital. In terms of working with care homes, I mean, again, one of the things we've seen as a response to the COVID pandemic has been a very clear clinical lead identified for each care home to make sure that there is strong clinical advice and input for care homes as they require them. I think we need to build on that moving forward, picking up your point.
Kelly, can I come in? Sorry to interrupt. It's relevant to this, which is we need to acknowledge the enormous amount of support that has come from the care home multidisciplinary team in Telford and Wrekin, and that's a team hosted by Shropcom, the Community Health Trust, who have been in pretty much every care home across Telford and Wrekin, especially the ones with the outbreaks, and have given the most enormous amount of support to the staff there, and I see that actually continuing. So I think, in answer to your point, Andy, that is already happening in a big way.
That's good. Right, excellent.
Sorry, I'm interrupting again.
That's all right.
Just to say, in a sense, that that MTT work was something that we've started through the TWIP. So actually, I think the work that we've done at place level put us on the front foot and a good place in terms of that support into care homes. It was one of the projects that in the early days we kicked off through the TWIP programme.
I've got two more hands up before Dave has to go, I think. So I've got Councillor Tomlinson and then Barry.
Thank you, Chair. I think most of the questions have been asked. I think my concern was that releasing people, discharging people from hospital into the care homes. We have experience with the fact that my mother-in-law is in a care home. We're really fortunate that she's in Walsall, and it's the only care home she's in that hasn't had COVID-19. They do keep testing. Obviously, the answer would be before people are discharged to test them before they do go into the care home, because, as you quite rightly say, David, it's really difficult because she's in an environment where the floor she's on, they all have dementia and they all do wonder. And it got to the point where they had to actually lock people into their own rooms, which is not really good enough when you've only got 6 members of staff to deal with 20 people on that floor. Because they were really worried about infection, because they were forced to accept a resident back who hadn't been tested, and they were really worried because obviously it spread throughout all the other care homes in Walsall. So it is a concern to me that residents are tested before they go back, particularly those with dementia. Because you can't lock them in their rooms. They're already confused as it is without adding and exacerbating their own situation. And Liz, I'm really glad that you mentioned that they need to be applauded. We are so grateful for what they've done where my mother-in-law is, and I'm sure a lot of the other family members, wherever their loved ones are, really applaud the work that they've had to do under really difficult situations without having all the PPE. It was dreadful, really, the way that we have treated some of the staff in care homes throughout the whole of the country, not just here, obviously. The other thing is slightly different, going off a little bit, was that we also have a situation where we've had to bring my sister-in-law here. She's got learning problems. Now, I don't know whether it's an issue that we would need to look at here, but she sort of didn't quite, as to say, slipped through the net, but basically the carers said she wasn't bad enough to still have care, so they stopped the care. Also, the district nurses said that her problems with ulcers on her legs was better, so she wasn't bad enough for district nurses to visit her. So therefore there was no one seeing her to make sure that she was okay. We took the decision to bring her here because her housemate kept going out because he's got learning problems as well. He wouldn't stay in. He wouldn't stay in the lockdown. So it's a concern to me that if people are living in semi-independent environments, the fact that some of their care is being actually ceased because of the way the situation was. Obviously, things are getting a little bit better now, but we can't let her go back home until things improve. So that is a concern of mine. I mean, I'm talking about Birmingham here, but I don't know how it is in Telford and Wrekin. Thank you.
Thanks, Karen. If I just put a point of clarity in first, because I do want to make it clear, any patient now who gets discharged from hospital, and this has been the case since the guidance came out, and I can't remember the exact date of the guidance, but it's a good 4 or 5 weeks now. Any patient who comes out of hospital has to be tested before they come out, and they do have to be in some either self-isolation at home or self-isolation in either a community hospital or a care home setting to make sure that they are COVID-free before they mix with other residents. So completely understand what you were saying about how it was, but actually we have moved on since then, and I can assure you that is the case for every patient that's currently discharged. I'm disturbed to hear about your sister-in-law, and more than happy to have a conversation outside if that would be helpful. I don't know the exact situation locally, but I would be concerned if we were doing similar things, although undoubtedly we have I'm sure across health and social care stopped some services for people, but I hope we haven't made them more vulnerable, and we possibly need to look at that to make sure.
Can I just say that the care company do phone us and ask us how she is, but because they had other people with greater needs, they had to stop, because obviously a lot of staff were isolating, so you've got the situation where you've got reduced staff. So it is a concern that, you know, we could potentially be leaving some of our vulnerable people without that assistance. That was all, really.
No, I get that. I will have a look at that.
Thank you. Barry?
Yes, thanks. Can you hear me?
Yeah.
Okay. Yeah, I'd like to pay tribute to what we've seen in the multidisciplinary, multi-agency working, which has been a credit to everyone in Telford and Wrekin. We've seen practices come together that the STP would have never dreamt of a year or so ago. So let's hope that we can consolidate from that. Health Watch are actively involved in restoration task and finish groups. And we will certainly be looking and feeding back from the public's perspective in terms of what we think there. And it's good that we see restoration, but we also have to look at in the longer term of reformation of services, how we reform services, what we've learned. The excellent practices that have come together where you've got nurses and social workers in the voluntary sector all working absolutely fantastically. We need to pick out the good and ditch the bad. And that's the difficult job that the restoration groups have got. One thing I'd like to highlight, we've been active in Health Watch on surveys and engagement by virtual means. One of the things that's coming through strong, which David knows because we had him at our board meeting the other day, is that there's a fear factor. We're picking up from correspondence and other means a fear factor of going to GPs, a fear factor of going to E&Es. And it's a real fear factor, which was highlighted by a GP in London on TV today. He said they're afraid to come to my surgery. I think we've all got a responsibility, from David to primary care to the voluntary sector, to try to reassure people that it is safe. People are returning, David, but I think they're returning in desperation because of pain and all the other things. But I would like to throw that open to everybody, because I think it is an area that we're picking up that we really all need to concentrate on. Thank you.
Thank you.
Thanks, Terry. I mean, I understand that, and we do need to make sure that we get the right messaging across for the public so that they do recognise that when they come into services, it's safe. All GP surgeries currently are still giving out messages around if someone's got symptoms, not to go to the surgery, to phone, telephone triage. They have got designated designated areas for any patient who is COVID positive or suspected COVID positive that has to go to the surgery, and that is away from areas for patients who aren't suspected of having COVID. And similarly, in terms of part of our restoration plan moving forward for the whole system, we are actively looking at how we can create COVID-free sites to enable the public to have a bit more confidence. And indeed, some of the actions we've taken during COVID in terms of moving phlebotomy services and moving the urgent care centres, for example, was to provide some assurance for people that those services and locations hopefully were as safe as they possibly could be, rather than an acute hospital site.
Do we need to reassure public that you have got these COVID-free areas? It's good to hear that you're doing it, but maybe they need to know that their GP has a COVID-free area. That would be helpful. Thank you.
Okay.
Jonathan?
Yes, Chair. Just quickly, I got some good news that came in late yesterday, early evening, really, around the support for care homes in Telford and Wrekin. You've heard a lot of positive news and the system working well, and Telford and Wrekin Council working well in relation to this. Well, as a council, and like all other councils, we had to submit to the government on the beginning of June a care support plan. And we had feedback yesterday from the regional panel that looks at all those care plans, and their feedback to Telford and Wrekin Council last night was extremely positive. They identified a number of good practice areas where we have been supporting as a system, as a council, the care homes, and they will be passing that to government as well. So they identified, I think, 9 areas of good practice that they would be recommending to others. So I just wanted to share that with you because it just came in.
So a little late, Dave. I know you've got to leave, so.
No, that's okay, Kelly. I'm more than happy to stay for a bit longer.
Okay, I think that's everybody who wanted to ask questions on yours.
Thanks very much. Good to see you all.
Take care. Thank you.
And you. Bye.
Bye-bye. Okay. So we'll go back to the original agenda. So apologies for absence. You got any apologies?
Sorry, I didn't have my microphone down. Yes, apologies from Superintendent James Baker and Cabinet Member Councillor Shirley Reynolds.
Thank you. Is there any declarations of interest on the remaining agenda items? I'll take that as a no. Great. Minutes of the previous meeting. Anybody got any comments? Are we happy? Okay, silence I'll take as a yes. I'm happy. Any public speakers?
I've had no contact from the public, so I'm going to go with no.
Okay, so the next item is item 6, the Care Act Easement, and that's been presented by Sarah Dillon.
Morning, everyone. Can you hear me okay?
Yep.
Great. This is just to update you on, you've had the paper on Telford and Wrekin Council's process within the Care Act easements. So as you know, most local authorities' duties in adult social care, there's a bit of feedback there, fall within the Care Act 2014. And the Coronavirus Act of 20 permitted some easements of Care Act duties, as you've seen in the paper, and it describes in Telford and Wrekin what easements or what flexibilities we have put into play. So it's just to make you aware of those and take any questions. So the amendment allowed us to rate ourselves on under 4 different levels of permitted changes into the delivery of the Care Act duties, with the first one being virtually no changes to delivery, and the fourth one that I think Councillor Tomlinson may have mentioned earlier, where some areas have moved to level 4, where there's been significant impact on their ability as a council to deliver adult social care. So In terms of Telford and Wrekin, we have rated ourselves at level 2, and that isn't fully implementing the easements that were permitted under the Act. It's really rather, I'd describe it as flexibilities that we've employed, and I'll go on to describe those loosely now. And the reason we've said flexibilities is there has been some impact on the service types that we've been able to deliver, and some of the duties that we've had under the Care Act have been delayed or potentially cancelled in the short term due to the impacts of the virus. So just to briefly go through the 4 main points really. So in the amendment it said that local authorities will not have to prepare or review care and support plans, but they will be expected to undertake proportionate work, which is still person-centred. So in Telford and Wrekin we've continued with our Care Act duties in terms of scheduled reviews and assessments, but we've undertaken these remotely where this has been possible. Obviously, where there's been an urgent requirement, we've continued to undertake face-to-face work, but that's been minimal, and we've done most work remotely. We've continued to collaborate fully with all partners, and in particular the individual and their family and key system partners. So the second duty was that the local authorities normally under the Care Act have a duty to meet eligible care needs, and the amendment allowed us the power to meet needs for individuals and their carers, and it required us to take reasonable steps to continue meeting needs. And it allowed that if local authorities couldn't continue to meet needs, that it could actually prioritise the care and support that it was delivering on behalf of local people. So this would allow us to temporarily remove support and apply it in other places. It's important to say under the level 2 flexibilities we have not needed to do that. As other people have mentioned earlier on, we've had considerable support from our provider sector in Telford and Wrekin. We've continued to have good availability of domiciliary and residential care, and there's been good liaison with the health and across the health and social care system and the voluntary sector to support that provision, which is, it's a really positive news story for local people in Telford. In terms of mitigating some of the risks, in terms of us undertaking some of our work remotely, we implemented virtual welfare checks or visits where it's necessary for those people in vulnerable groups, people with autism, dementia, and those awaiting for occupational therapy services. We have had regular weekly contact with people with a learning disability who usually use our My Options service, which incidentally has been the main service affected because obviously for social distancing reasons, people with a learning disability coming to our building-based day services have not been able to do so since the outbreak. But we've maintained contact with them, and we've also increased our virtual work with individuals with a learning disability. For example, we've been using portals or platforms, as you call it, like this one we're using today to support individuals remotely where that's been feasible. We've continued to work with partners, as has been mentioned earlier. We've got twice weekly learning disability multidisciplinary team meetings with partners virtually to make sure that we're working collaboratively to meet individuals' needs, and we've done a similar process with mental health. Just another example, we run a Calm Cafe with partners to support those with mental health problems, and we've been able to do that virtually. We've been part of an integrated discharge hub based on the Royal Shrewsbury site, and that has been 8 till 8, 7 days a week to enable people to leave hospital as swiftly as possible to reduce risks. We've also introduced a carers and direct payment personal assist card to those people moving around the borough during lockdown to show their purpose. And we've had regular contact with the Wellbeing and Independence Partnership in the voluntary sector to support their work around information and advice during this period. We did another easement was around financial assessments, that these don't need to continue. In Telford and Wrekin, we've continued to undertake that work, but we have introduced a 3-month suspension of client contributions in recognition for the impact of the virus on individuals. And as I said before, we've continued to undertake our Care Act duties in relation to assessment and reviews, but we have done this more remotely. We haven't changed any of our processes and procedures around recording, which has been reported in other areas. And just to summarise very briefly, our main impact has been the pausing of day opportunity services for people with a learning disability, but we've continued to maintain contact and undertaken tasks virtually. We've had to temporarily suspend respite care at our Lakewood Court residential home, given the obvious risk, but we've been providing this in different ways for individuals where required. And there has been a delay on minor works in terms of equipment and occupational therapy. But I think just to sum up, really, we've been very fortunate in the support of our external and internal providers and partners in maintaining this approach in Telford and Wrekin. And that's the end from me. Answer any questions.
Thank you, Sarah. I've got 4 hands up at the moment. First one was Councillor Tomlinson.
Thank you very much, Chair. Yes, I must apologise. I was looking at my notes. I've got notes one side and my slides on the other side. So I actually asked David, or mentioned it when David was on, so it should have, Sarah, been mentioned to you about the fact that I have a sister with mild learning difficulties. Obviously it's a Birmingham thing, so I'm really pleased that we are so strong. We have done so much in Telford and Wrekin, so thank you very much for that report. And I'm just pleased that we are looking after our vulnerable adults, because obviously it is a concern that I don't want any to slip through the net, which I feel it has done in my sister-in-law's case. If people they're not considered to be bad enough, then that light touch doesn't happen, and therefore it's very difficult for families like ourselves who live 40 miles away to keep an eye on someone with difficulties like that. So I'm really pleased that we are going that extra mile and then helping those people. So thank you very much.
Thank you.
Thank you, Barry. Barry, can you hear me?
Can you hear me now?
Yeah.
Yeah. Just like to say thanks to Andy and Sarah for briefing Health Watch as to what we've been doing going along. I raised this in May and I've been fully briefed as to what's happening. Some authorities have rescinded the emergency regulations. I think from the last I heard, there's only 2 authorities that have actually got it in being. Can we see a date where we'll rescind the emergency regulations and back to sort of normal pre-COVID assessments, etc., plans and whatnot? I think it's important for people to know how long this is going to go on for.
Yeah, absolutely, Barry. It's a good point. I mean, I think the ones that have been reported are in relation to councils which have gone much further up the scale in terms of the amendments that they have made, the easements that they have made. We are only at 2, and that is some flexibilities. And the biggest area for me is our daytime support to people with a learning disability, and we're actively working on a new offer with people. Everybody is having an individual conversation about their own personal circumstances and what is best to support them within the social distancing requirements at the moment. And that's a big piece of work for us. So I think until it would be too early at this juncture it would be against the rules to bring people into those buildings at this stage. And that forms part of our judgment at level 2.
Can I just confirm that we've had no concerns raised by Healthwatch by our surveys whatsoever, and that's a credit to the good work that you're doing, Sarah, Andy.
Thank you.
Thank you. Councillor.
Yeah, thanks, Chair. Thanks, Sarah, for the report. I mean, it's a really good report. And my questions are basically, are we taking learning from this, that in the future there is different ways of operating, and also is there an investor save option where those people who may not have access to tablets or some virtual hubs could get that assistance and then not require the support in the future, which is a heavy cost? The second one is, are we mindful that I read the report that, you know, I'm nearing 50 and I do some caring duties. I wouldn't want you ringing me all the time. And it says carers over 50. Are we mindful that some people don't need you to ring them all the time? And are we judging that because some people might judge the council ringing them that they're doing something wrong, then you're offering them support? So I'm just saying, you know, we have to be mindful how much stuff we do because some people are able to do some of the things themselves and will not appreciate it, while some people will really appreciate it. So they're the two issues really I just wanted to raise from that.
Yeah, thank you, Richard. Just for the last one first, I think you're absolutely right. What we've been tending to do is make a call to individuals and be led by them really as to what their needs are. Often we've worked very closely with the Wellbeing and Independent Partnership, and it's actually a lower level conversation around what's available in the community for that person. The issue that you raised around new and different ways of working, I think that's an important one that we mustn't lose. So the conversations that we're having with individuals and their families at the moment is how what a new offer looks like, what that technology, and absolutely if we require some support to enable people to get tech savvy or to get equipment and other means of undertaking some of their meeting some of their needs that way, then that's what we will absolutely do. It's incredible to see the moves that everybody has made actually towards technology, and to see people, particularly with a learning disability, using platforms such as this to connect with people and to share skills and experience has been absolutely fantastic. So I think we have to work further on that and you know, move the service forward.
Thank you. Councillor Burford.
Yeah. Thanks, Kelly. Yes, just to amplify one or two of the points that have been made. I mean, I think Richard's point is a good one about a sensitive approach to contacting people. I mean, I think we've been very good locally at the way we've contacted people, whether it be the very vulnerable or anyone who we thought is in need locally. We've made huge numbers of calls to people, but we have to be careful that we don't overdo that contact for the reasons that Richard said. But I mean, we've got a very good record locally of doing this. And I think some of the reasons we're able to go only to level 2, we were able to go only to level 2 with the easements, was because of the strength of our relationships with the voluntary sector and with partners. We've been able to provide that support and that coordination within the community as a result of that, and that's a testimony to, I think, the way we work together within Telford and Wrekin. Having said that, I don't think we can underestimate the strains that this is putting on carers. I mean, for example, Sarah mentioned adults with learning disabilities. We've been very aware of just how much pressure this has put on carers at home. And I think finding new ways of providing respite, even on a one-to-one basis, by bringing them into places on a one-to-one, has been really important. You know, I think we can applaud ourselves for what we've done, but we do have to recognise that whatever we do, this has been a very difficult time for carers. Thank you.
Thank you, Caro.
Yes, I just wanted to support what Andy's saying. And I think one of the learning points has got to be about what we used to call making every contact count. so that if a partner was in contact with a family or with an individual, that the most seamless referral into the voluntary sector or into social services or health services can be done there and then without that individual or family having to talk to multiple providers. And I think, as people have said, that good partnership working and good levels of connection are vital.
Thank you. I think that's it for questions. Thank you, Sarah. Thank you. So the next item agenda is 7. There are some recommendations for the board to approve for the health and wellbeing strategy refresh proposals. So just to clarify that, to note the actions today on creating a single strategic commissioner for Shropshire, Telford and Wrekin, and note the feedback outlined in the engagement report approach attached. So that's Helen. Can you hear me, Helen?
I can. Are we doing the health and wellbeing strategy, Kelly? I think they may be in the recommendations for the single strategic commissioning paper, were they?
Right, okay. Scrap that then. We'll do number 7. I do apologise. I was doing well so far. So we're going for the health and wellbeing strategy refresh proposal.
Thank you.
Item 7.
Do you want me to introduce, Liz?
Please, yeah.
So in February, the board were very supportive of the proposals we put forward for the refreshed health and wellbeing strategy. And we were going to do some further engagement work. We'd already carried out quite a lot of engagement work pre-draft, but we were going to do a bit more engagement on once we'd had those priorities supported by the board. In February, though, we couldn't have imagined the impact of the coronavirus pandemic. And so we've taken this opportunity to reset the strategy by introducing it with a new forward, which gives the pandemic context in terms of the impact and also that look forward in terms of the post-pandemic. Clearly, it's affected us in many, many ways. Particularly challenging our emotional health and wellbeing, and links to some of the other papers here around care sector, but also around the NHS and NHS Restore in terms of getting those services up and running again when people have been living with worrying symptoms. So I've just got the right. Hopefully, I can share my screen. And just give you, can you see the proposals there?
Yeah.
As an overview. Yeah, so what you see is that we have the priority programmes for TWIP that we'd recommended as priority on the left-hand side. The board had approved a priority call to action around emotional and mental wellbeing, which is particularly important and has that COVID-19 impact context as well. We wanted a focus around reducing health inequalities and have set off a work programme around that. But given the update and the pandemic, we're also proposing a new priority around health protection. And this relates to our expanded duty in the Council for Health Protection, working with Public Health England on the prevention and control of outbreaks. So I think I just want to leave it there and see if anyone wants to ask any questions or Liz might want to come in.
Yes, can I come in, Kelly?
Yeah.
Welcome Helen's introduction to the health and wellbeing strategy. I think I just wanted to highlight a couple of things. The health inequalities priority is now really key because in terms of the pandemic, we were seeing health inequalities increase previous to the pandemic, and it is more than likely that health inequalities will have widened as a result of the pandemic. So it's really important that we have a cross-council and cross-partnership approach in terms of reducing health inequalities. And then I also wanted to highlight what Helen said at the end in terms of that 4th priority around health protection. and the need to develop outbreak control plans by the end of June. And to that end, I will need to have a plan in place by the end of June, and I would like to bring that to the Health and Wellbeing Board, and I would propose that we have a further meeting in July to receive that outbreak control plan. And I also need to set up some member-led governance around engagement around outbreaks, because whilst we will be controlling and doing our best to control outbreaks, there is a big piece around engaging the public in terms of doing the right thing, in terms of isolation if they're a contact, reporting symptoms, getting tested, and we need to build people's confidence to follow that guidance now. It's very crucial. As Dave said earlier in the meeting, we do need to be wary that we might have further spikes, and therefore controlling the rate of transmission of this infection is really important at this stage. Thank you.
Councillor Overton?
Yeah, thanks, Chair. I think Liz may have come in before I was going to speak, because I think it's really important. I mean, the health and wellbeing strategy has done a number of things over the years, which has reduced health inequalities, but I do believe that the pandemic will have increased health inequalities, especially the wider determinants of health. And I do believe that we have to make sure we put our money where our mouth is when it comes to community capacity and community resilience and building the communities to help support each other than us trying to direct it ourselves all the time. And that means health money as well, because I do believe that local communities will be better off if they can support themselves and help themselves to attack the wider determinants of health, as they call it. And that's my point, really. And I just think that we need to have a look following the pandemic what those wider determinants of health have gone as increasing inequalities, because we do know there's been a lot of job losses, etc., which it reduces income, and there'll be an increase of people in financial difficulties after this. So I think we have to make sure we do something afterwards to look at these issues and try and see how we address them, but taking partnerships forward through communities and charities and anybody else who can help localise that result, really.
Councillor Burford.
Yeah, sorry. My main point as well was going to be about health inequalities, but I think Liz and Richard have largely covered that. It requires a general approach to health inequalities across Telford and Wrekin, but it also requires targeted community action, as Richard has said. I think what this report shows is that we were right in terms of our priorities before the COVID issue. We don't need to adjust the main planks of that strategy, but obviously COVID puts a lot of the issues and our priorities into sharper relief. I welcome the amendments which highlight the kind of learning that we've had as a result of the last few months. So this I think stands us in good stead going forward in terms of the way we need to monitor our progress. So thank you.
Councillor Fletcher.
Sorry, I had to get my mic working. I read the document very carefully and I can see the way forward. But I noticed that we seem to be talking about children and people with mental health. But with our increasing ageing population, is work being taken to look after those?
Sorry, shall I don't know whether to put my hand up or respond.
Carry, Liz, yeah, carry on.
Sorry. Thank you, Councillor Fletcher. In a sense, yes, we've highlighted, children and mental health, but actually what this strategy is an all-age strategy, and particularly if you think about we've got a paper later on the agenda in terms of TWIP, partnership with the CCG. Much of some of the work they're doing is around older people as well, in terms of that integrated support, so having that wraparound support for older people. So it is absolutely all age strategy, and we do need to focus on our ageing population as well.
Okay. Caro?
Thank you, Chair. I just wanted to say that I think we shouldn't underestimate the way in which some of the issues that we've outlined here are going to be affected by COVID. I mean, Citizens Advice research has highlighted that 11 million people in England and Wales have already started to miss payment of bills. We know that there's a link between the stress of being in debt and mental health. 18 to 20% of the total workforce are going to lose their jobs. So there's going to be huge impact on families at a variety of levels. And also partners like Mind are reporting that the loneliness and isolation, which we know are as damaging as smoking or obesity, are on the huge increase. Organisations like Citizens Advice are expecting what's been described as a tsunami of debt. This is going to have a huge impact on emotional and physical health. People won't be able to eat properly, they won't be able to get out from under the stress for some time to come. And it's not just going to be in the next 6 months, it's going to be in the longer term. So we mustn't underestimate that. Thank you.
Thank you, Liz. Do you want to come back on that, any of that? Or?
No, just to say I absolutely agree.
Councillor Watling?
Yeah, I'd agree with what's being said. The answer, of course, is not with one agency, is not with one service. It's with our whole communities, and I believe we've shown through our response to the COVID-19 pandemic that here in Telford Wrekin we have a cohesive approach across communities to actually deal with these issues. These challenges will be there. I believe we do need to rethink how we fund different issues and different approaches, and we need to be looking at new partnerships that are sustainable for the future. And I agree with you, Caro. You know, how we do that has got to be has got to be an urgent thing for us. As part of our recovery reset and reform groups, we're looking at those issues and looking at how we can best move forward in that way. And I would welcome, sort of the input of all our communities to be involved in that process. Thank you.
Thank you. So just to be clear, the recommendation is the Health and Wellbeing Board's asked to approve the proposals. I'll take if you don't let me know, then you're accepting that. So, yeah, I assume that's been approved. Okay. Thank you. Item 8, Joe Leahy. Just to say, this is Joe's last meeting. So as a board, just like to thank you for all her hard work. And to also, for us to be mindful that any questions from her presentation, she won't be able to follow up from, so that will have to be handed over. So potentially we may have to wait and see who replaces her for. So just be mindful of that with the questions. So, Jo, thank you.
Thanks very much, Kelly. Thank you. Yes, so since I last spoke to the board about the plans for the single strategic commission organisation to cover the whole of the county, and that was a long time ago, and we've come a long way, and I'm sure you've all read the report. The most recent changes have been that an engagement exercise was carried out across the whole county with the public, and the engagement report is in with the papers. Obviously, only a relatively small number of people, a very, very tiny proportion of the population did engage with us on that, but I guess the vast majority of people don't really understand what the CCG is anyway, so that's to be expected. The other things that have happened that are significant is that at the end of May, the clinical board members for the new aligned CCG boards were elected. So 3 clinicians from Telford and Wrekin, that's Dr. Adam Pringle, Rachel Bryceland and Fiona Smith, who are both advanced nurse practitioners, and 3 GPs from Shropshire. So they will be part of the new board, the new aligned boards, I should say, which will meet together from August. Well, the first meeting, I guess, will be in September, but those boards will come together in August this year. And that group of 6 clinicians will choose a chair from amongst them by the end of next week, I understand. So also we met the NHS England and Improvement Panel last week on the 3rd of June to request authorisation for the new organisation, which is due to start on the 1st of April next year. And actually, it was acknowledged by the panel that we'd come a huge way, and I have to express my thanks to Alison Smith and her team. Alison couldn't be here today to present this, but she's done the most enormous amount of work. You cannot imagine the amount of work that has been involved in pulling everything together for this application. We got favourable feedback. We won't get a result as such for some weeks yet, and we believe it will have to go to a national panel because of the finances involved in the 2 CCGs. So that's pretty much the update, and I'm happy to answer any questions as far as I'm able. And as Kelly said, any I'm not able to answer today, we will get we will get answers to you. And although I won't be at the next meeting, there will be somebody, either the new chair of the organisation or the vice chair of the new aligned boards, and this board isn't quorate without someone from the CCG, so it'll either be the chair or Dave, so somebody will be able to answer the questions. Okay.
Thank you. Councillor Tomlinson.
I think you're on mute, actually.
Yeah, you're on mute, Karen.
Sorry, I thought I'd clicked it too fast. Right, sorry, Joe. Sorry okay. That you're not going to be with us again. I will be saying things, but they're not obviously personally directed at yourself. So please don't feel that I'm having a go. Right. Yeah, I was a bit disappointed where the actual pop-up meetings were, because I don't think that they were widely spread enough. I do take your point that some people, members of the public, don't always understand what your body entails, what the CCG is. But I have had a few comments from people, because if you look on page 50, well, page 4 or 58, whichever one you want to look at, but saying that the Tesco supermarket in Wellington, it's actually on a retail park. People in Wellington I have had comments, being a Wellington Town Councillor, that there wasn't anything there for people to make any comments within the town. It is the largest town in Telford and Wrekin, so I am disappointed that there wasn't anything there. There are many areas of deprivation within Wellington, and I do think it will have an impact on some of those residents. So I am disappointed. Also, it was also mentioned to me from people in Newport. They always feel that they're out on a limb there, that they felt that Telford is a long way for some of them to go, and they were disappointed that there wasn't any pop-up facility for them to have it explained to them what the repercussions are. So I'm sorry that sounds a bit negative. Also, I suppose I was a bit disappointed that maybe that 5 of the Telford and Wrekin CCG actually abstained. I'm just disappointed they didn't possibly vote against. That's not under your control. I am pleased that it will be an equal split of 3-3, so I am pleased about that. So I'm glad that you brought that up, and it's something that I was going to mention. Also, when we're talking about are we going to have one site or 2 sites for people to meet, I'm not quite sure how that's going to happen. Obviously, there's a staffing implications if you can have 2 sites, so I'm not quite sure how that's going to work. And I just hope that it's going to be a good way forward for everyone, really, and onward and upward, really, because I think we just need to move on and realise this is happening, and we need to be a part of it working. Thank you very much.
Can I respond, Kelly? Is that okay? I certainly haven't taken any of that personally, Karen. As far as the sites go, I think the experience during the COVID outbreak has been such that so many people have managed to work effectively from home that I think there's going to be so much remote working going forward after this that the site will become less important. And it may be that there'll be 2 hubs rather than any particular centre. I don't know, and it's not under my control, but the experience during the outbreak will definitely have an impact on that.
Thank you. And Overton?
Yeah, thanks, Chair, again. Thank you, Joe, as well, for all your work you've done on the health and wellbeing. It's been a long time since I've been here. We worked together quite well before, so good luck to what you do in the future, etc. I've never supported this merger, but we are where we are, and we move forward. So my issue is around. I mean, there is some comments in the engagement. My issue is about commissioning, really, in the future, because they are 2 distinct areas, Shropshire and Telford and Wrekin. We have some distinct needs that Shropshire doesn't have, so we have to make sure when the commissioning time comes for this organisation, it realises the different issues, so it doesn't just commission for Shropshire, a rural area, and forget some of the urban deprivation and wider determinants of health that we have in Telford and Wrekin. And also, we must be mindful that some of the health funding should be addressing those issues than just medical needs, because debt counselling it does help people's health. So funding shouldn't just go to medical things all the time. It should go to some of the community-based support, some of the charities that give financial help, that give even exercise classes in the community, that gives mental well-being support. Because the trouble with health money is it always seems to go at primary care or into A&Es and emergency care, when actually if we focus in our commissioning onto community-based assets and community-based support and move people away from the emergency angle and primary care, we will get better determinants of health, and people will not need to go to those things. It's about taking some of that money sometimes and being a bit more radical and giving it at the bottom and helping that support. And I think that's what I'm going to be watching with this organisation, that it actually commissions for their public health outcomes and not just primary care outcomes, because it's very important that if we get the bottom right, the top will need less funding in the future.
Yeah, I think it's worth focusing on TWIP as well in their later report, because that is the TWIP group is really the kind of area that will push that forward. I'm sure that the CCG will continue to be completely engaged with that. You know, it'll be probably on a locality basis.
Councillor Ireland, did you want to?
Yes, thanks, Joe. I just wanted to say thank you, Joe, for all your work with the board. It's been a pleasure working with you. Richard has you know, clearly put forward some of the points I wanted to make, which is the preventative work that we do together as a CCG and a council is so important. And one of the things that have been good about having a local CCG instead of if you like, semi-regional CCG is that we've been able to concentrate on those things. What I would want to do is make sure that the representatives who come onto the board from the CCG understand that partnership and understand the fact that there is a difference between the bigger picture for Shropshire and the bigger picture for Telford and Wrekin, I do hope that happens. I'm disappointed it's only one GP and then other members of the staff there and 3 GPs from Shropshire. So is there a reason for that, Joe?
So the board members are elected by our practices, 1 vote per practice, and it's hard to say, but I suspect there was some political undertone to the way the voting went. And that's all I could say in public, to be honest.
Okay, thank you, Joe.
I mean, there is a huge positive in that it's a great way of bringing other clinicians than doctors into that level of management. You know, so one of our AMPs, Rachel Bryceland, has been on the board as a clinical member for the past year now, and she's just been amazing. She's really, really good. She's made some huge positive differences, and that also helps with the public perception of our nursing colleagues. So I would say that there is that positive. So Fiona Smith, who's an AMP at Shawbert, she's new to the role, so it'll take her a while to get into it, fair dues, but I think she'll be great. I really do. I suppose the concern I would have is, will they be outpowered by the GPs? I can't imagine Adam Pringle allowing the GPs from Shropshire to outpower our nursing colleagues.
Right, but it is an issue. I mean, that is an issue for me in terms of that hierarchy within the health service, and I do know that you as GPs are very, very powerful.
Well, more perception than reality, I think.
Councillor Burford.
Really, just add my voice to that of others in terms of thanking Jo for everything she's done and wishing her the best in the future. Under normal circumstances, I'd have liked to have met you face to face, Jo, to say that, but this is the way it has to be done at the moment, unfortunately. Just the points I wanted to make, I keep coming in third or fourth, and the points that I was going to make have been made. So just to sum up, really, the critical things for me going forward in terms of how this joined up CCG can work in a fair way for Telford. First of all, it must be the distribution of resources and the allocation of those resources. It must be on a population health basis. I mean, we've got a in part deprived community in Telford, and we really need to make sure that the way that things are carved up is done in a way that addresses those needs and those inequalities we've talked about. So that's the first thing. Secondly, the management needs to be joined up. We've got a good record recently, especially through COVID, of ensuring that management approach is joined up, and we need to strengthen that and make sure that continues to be the case. TWIP, as has been mentioned, is absolutely key to this. If we're going to have a devolved approach, and if we're going to strengthen our community work in this area, then TWIP must have the means to allocate those resources. And as Paul says, and Richard said, both in terms of home care needs, but also in terms of health needs as well. So those points are absolutely central to making this work in a fair way for Telford. I've had my doubts about this all along for the reasons that have been stated, but if those things are addressed properly, we can make it work.
Thanks, Andy. And I mean, I know I've said this before to all of you, but this is not what I would have chosen. But it is what it is. And I think one of the really good things is that David Evans is the Joint Accountable Officer. He's been in Telford now since 2012. He understands Telford and Wrekin really well. And you know, I really believe that he won't let the needs of Telford and Wrekin go unrecognised.
Councillor Reynolds.
Thank you, Chair. Firstly, apologies for arriving late. I had real problems with my internet connection, and it's taken me so long to get connected today. A lot of what I wanted to say, like my colleagues have already said, have actually already been said. But firstly, thank you to Joe. It's been an absolute pleasure working with you over the last couple of years, and I want to thank you for all the work that you've done. And moving on to that, I've got very similar concerns, really. This joined-up approach for Shropshire and Telford, it has got to be a fair allocation of funds, really, throughout the percentage of the population, and need to consider the deprivation and the health and the wealth of the communities to ensure that the inequality is addressed. And I think that's got to be at the heart of all that we do. I agree with everything else that's been said, so I don't want to just repeat for the sake of. And as others have said, this isn't my choice, but we have to make the best of what we've got for all our residents.
Thank you. Liz?
Thank you, Kelly. Yes, I'd like to add my thanks, Joe, to all your leadership and support over the last few years. You will be missed. So thank you very much from a personal point of view from myself as well. I just wanted to, Andy has summed up and Shirley has in terms of 3 key points: fair distribution of resources, the management structure and the central position of TWIP. And I wonder, I mean, we've all recognised that Joe isn't in a position to answer the specifics to those points, but we should perhaps put them in a letter or a format whereby we could ask the CCG or Dave to respond, because I think that is the central position that this board has, and in a sense not to lose those points and to seek some a response to those. I think they're very good specific points. Thank you.
Thank you, Councillor Fletcher.
Thank you, Chairman. First of all, the engagement report, which I read with great interest. It seems that hardly anybody actually took part in it. It could be because they didn't know about it, or perhaps they weren't properly advised that it was taking place. I mean, 71 or 75 people in total out of the whole total of Telford and Wrekin and Shropshire actually making comment. It's ridiculous as far as I'm concerned, and doesn't really have any validity. I'd also like to agree with my colleagues from Telford and Wrekin. We are going to lose out, as far as I can see, that all the resources that we, working together with the CCG and the council, have put into the communities and such like, are going to be taken away from us. And I am definitely not in favour of this proposal. Thank you.
Thank you. Do you want to come back, Joe? Or?
I don't see all our Wrekin by any means. I think Telford and Wrekin is a very strong locality within the wider county, and we have to speak up for the needs of our population, and that will happen via TWIP and via the board. And having an equal number of clinical board members to Shropshire gives us a stronger voice. I mean, there were many voices in Shropshire that thought that we ought to have proportional representation on the board as clinicians, and that would have meant 2 out of 6, which makes a difference. At least it's actually balanced. So I wouldn't be too gloomy about the allocation of resources.
So just the recommendations are for the Health and Wellbeing Board to note the actions taken today on creating a single strategic commissioner for Shropshire and Telford and Wrekin, and to note the feedback outlined in the engagement report attached. So if anybody wants to say if they don't, and then, okay, Liz, did you want to?
I just wanted to add the recommendation to write on those 3 points that Andy made for a response to the CCG.
Okay.
Thanks, Liz.
No.
Agreed.
Yeah. Agreed, yeah.
Oh, it's a raising hand.
Well, it's probably easier if you disagree to let me know, but then I don't have to look at you all agreeing with me, is it? Okay, thank you, Jo.
Thanks.
So, Chair, sorry, when I raised my hand, what I was trying to say is
go on, sorry.
Yeah, was that I probably, I think the majority of us aren't happy about the merger. I think we just have to proceed because we have no option. Obviously, reluctantly, we have to, we have to accept what's been put towards us. But I'm really pleased that Liz has mentioned, putting those formatted ideas forward. I think it is very important, as other councillors have mentioned, about the proportionality that's shared out, particularly for the fact that we have quite a high amount of deprivation. Thank you.
Thank you. Okay, agenda item 9, and it's been presented by Tracy Jones.
Thank you for uploading that, Sarah. That's very helpful. So for those of you who haven't met me before, my name is Tracy Jones and I'm the Deputy Exec for Integrated Care, working at Telford and Wrekin Clinical Commissioning Group. And I'll be co-presenting this with Julie Smith, who I believe is also now on camera. The paper you will have received actually looks at the whole range of work we've done as a TWIP group. And I'm really pleased to hear the references that we've had to TWIP as we've moved throughout this Health and Wellbeing Board meeting this morning. So what we intend to do is just to pick out some of the key points of the paper. Julie and I will talk through that presentation. It will last approximately 5 minutes, and then we'll open to questions and points of discussion. So Julie, if I could pass over to you for the second slide.
Yes, thank you very much. As you can see, with a wide group of Telford and Wrekin partners, and we've highlighted those on this slide, we've built on existing work and developed the plan as outlined within the paper. So this really is a retrospective look of progress to date since the formation of TWIP 11 months ago now. However, with a couple of examples of, and it's been great to hear people such as Jo, Barry, Liz and others mentioning the work of TWIP, we wanted to just outline a couple of cases where we've worked cooperatively during the COVID-19 pandemic and where there's been real escalation of the work. The purposes of TWIP really is to drive change here in Telford and Wrekin, priority being services in the place, deliveries built to fit with the people and the place they live in, and each place, as we know, has its own diversities. Slide 2, Sarah, please. One of the projects that we thought we'd look at for the presentation, we've chosen, as I said, 2 projects which demonstrate the escalation and differences they've made during the COVID-19 pandemic to people here in Telford and Wrekin. And the first project is volunteering, which was well established here in Telford in neighbourhoods. And this slide demonstrates some of the escalation and support of people, of Telford people, to help their fellow Telford citizens. Next slide, please. Other TWIP projects. The paper highlights the progress of the numerous and diverse range of projects which have been delivered at pace in Telford and Wrekin. The integrated projects delivered are across a range of partnerships, as you can probably see, such as the NHS, public health, adult social care, children's social care, the primary care networks, independent providers and voluntary organisations. And as you can see from the slide, there is a wide range here. They all interweave and they are highlighted fully in the paper. At this point, I'll hand over to Tracy Jones.
Thank you. So one of the projects that we particularly wanted to report back to you as the Health and Wellbeing Board on is a project that we have spoken in brief to the board about as it was about to be launched, and that was coming together of the existing teams around health rapid response and social care rapid response. So we all know, and we've actually spoken about it at length in different ways this morning, that health and social care are completely interlinked. So what we wanted to do was to bring together the 2 streams of teams, because we believe that by bringing together health and social care, we're actually going to get a lot more than what we have when we deliver the 2 services as parallel independent streams. So it was a co-located service. It was for anybody who was over 18, who was having a rapid decline in their health and were in crisis. And it had the primary aim of preventing admissions and keeping people in their normal place of care. So if we move to the next slide. So we thought it would be really good just to highlight some of the feedback from the people who've used these services. So you'll see on this slide in front of you some of the things that people have said, and when we look at them, although they may appear like a short sentence on this presentation, they're really, really impactful when you think of the difference that the team have made to these people and their loved ones, and how the amount of coming together and not having to go to various groups to get what they need has really made the difference. And if we all now look at the overlay of the feedback from the stakeholders, we can see very similar points. So these are our stakeholders who are referring in and actually using the service. And we've had really positive feedback in terms of the quickness of response, because quite often it is the delay in response that will cause someone to have to go to the acute trust, because people feel as though their response isn't coming and therefore they need to take action, and they may believe that their only action is a hospital admission. And we can see here that sometimes it's just the smallest of things, like having coordinated advice, that makes the real difference. So just really wanted to share those 2 different perspectives back with you. So I think we'll open that up to questions and discussions. I can see a few hands. So, Chair, how you would like to do this?
Okay, Councillor Burford.
Yes, thanks very much, Julie and Tracy. I mean, I'm really glad you've chosen to highlight the rapid response team, because I mean, I think it's a prime example of the kind of partnership working that we've been talking about in the rest of the meeting as being crucial to be preserved and maintained through the post-COVID period. And I'd put alongside it the discharge team work as well. They for me, they sit side by side as a means of keeping people in their own communities and making sure that we get them back home into their own communities in a sustainable way when they come out of hospital. So it's a centerpiece for me. If we can't jointly between health and the local authority and our partners in the voluntary sector make sure this is properly funded, then we've failed, in my view. This is critical that we don't lose this going forward, and it will be an acid test that we really are bent on transforming services and keeping people home in their own communities. Thank you.
Councillor Watley.
Big fingers, that's the problem. You press it twice instead of once. I just wanted to thank you for Julie and Tracy for the presentation and reinforce what Andy said. You know, this is key for our transformation of services, and looking at the way we work on a place-based approach across Telford and Wrekin is key. You know, we've got success in places, and you know, it's really good that we've got that success. It's how we develop where there's less community involvement at the moment, and how we make sure that that's across the service, specifically in areas of isolated need across Telford and Wrekin, because I see places that are small pockets of health inequalities that get missed out because of the bigger picture we're funding in the past. And I go back all the way back, and I do go all the way back to single regeneration budgets, which were great, but they didn't deal with those issues. And I think, you know, we have to think differently about the way that we that we look at those isolated areas of health need. Thank you.
Councillor Tomlinson.
Yes, thank you both of you, Julie and Tracy. It's rather comments rather than questions. I think it's a fantastic system that we have, and it's best always to be proactive rather than reactive. We've always had the team around the child with the services around children when they have issues, and I think this is what we needed, have that team around those people in need, and to stop them having to go further into the system. If we can prevent people having to go into the hospital and keep them safe and at home, obviously that's the best outcome for everybody. So I think onward and upward, I think it's fantastic. So thank you very much.
Thank you.
Thank you. Councillor Overton.
Yeah, thank you. I mean, there's been a couple of points made. I mean, the emergency response, highlighting that is very good. And I'm just wondering how it builds into longer term responses to people staying in their home, as in like the DFG grant, because and I also think when we look at that as a whole system approach of how we support people to stay in the place that they call home and to live there, then we have to have a forward thinking view of it, because you know, I do feel that having been involved with the DFG grant with my parents, that it was a short-term look first and not a long-term look at what their needs would be as they deteriorate, because then you would have to come twice instead of once. So, and also how we look at social generation, as Paul says. So when we do go into these places where we want to do some place-based approaches, that we look at how the community can support people to live together in that community, and deal with some of the issues in that community, because you know we can go, you know, and hopefully going through this COVID will have people's perceptions change a bit. I mean, we now realise how valuable health workers are in comparison to football players. So hopefully we'll value people's neighbours, and the old way it used to be where your neighbour was there for you, and said how you saw how you was, and bring the community back to how it used to be, where people start cutting people's grass or checking on the neighbour and giving their health and well-being health check on them. as make every contact count is a health service thing, it would be great if it's a community thing where when we're making contact with people in our communities, we're seeing, if we see deterioration, if we see something where we don't think's right, we can feed in to get the best support possible to keep that person in that community. So I really welcome it. I just want to know how it feeds into the wider aspects of supporting people to stay in that place.
Can I come back on that?
Yeah.
I think as we've said, this is 11 months work building on sort of neighbourhood work that was started prior to that. And I think what we wanted to do really was highlight, and we have made some recommendations, which we would welcome your support on. And it is really that we are in Telford and Wrekin very welded to this place-based way of working, and as we know, the areas of Sutton Hill and Newport and Hadley are very different places, and the needs of people in those individual areas are very different and diverse. So really that's what TWIP as an integrated place-based partnership wants to really be sort of welded to.
We've got a couple more hands. I'm quite mindful of the time. Got a couple more. So Barry?
Yeah, I'm just absolutely delighted to hear the progress of the new team, the rapid response team, and what they're doing. Tracy and Julie are well aware that I, for the last 7 or 8 years, been banging the table for carers to be acknowledged. For them to be acknowledged their contribution to the health and social care economy, 38 million or so. And instead of reactivity, we've now got proactivity, and that's the other thing I've been on about for years. I am concerned what Andy says. It's fantastic progress. Congratulations to everybody that's been involved. We're now looking at carers in the home, keeping people in the home, giving support in the home, preventing expensive hospital admissions and readmissions. And Andy's on about the need for acknowledging during the pandemic how the importance of carers has been raised and how important it is to have additional funding to continue and further develop that, what Julian and Tracy are doing. But, we're talking about at the beginning of the report, cutbacks of quite considerable money, aren't we, over the next 3 or 4 years? That's got to be acknowledged. We need more money for this particular avenue. We need to prove to the government how cost effective this is at this present time, not just fall on deaf ears like it has until Tracy and Julie have got involved 11 months and done this fantastic amount of work, but to actually make it work continually, to be sustainable and to develop further and have the funding which it needs. Community care, we all know, is not the cheaper option. Keeping your carers in the community and the care for at home is not a cheaper option. So thank you for all the good work. Pass that on to the staff. I'm delighted. Thank you.
Thank you.
Last one, Karen.
Yes, just very briefly to support what colleagues have said. Paul mentioned regeneration. I'm slightly startled to be asked to go on the Town Deal Board, which is looking at the big picture around infrastructure, jobs, skills-based, and so on. And I said at that meeting, and I said I would say to this meeting, that well-being and infrastructure have got to work together, because it's got to be two halves or several parts of the whole. And I think the TWIP is absolutely central to that.
Thank you. Is everybody happy with the recommendations on this report? Yeah. Okay, thank you. Okay, moving on to agenda item 10.
Councillor Kelly, if I may interject, Stephen Trenchard has very limited time for his item to be heard. Would it be acceptable for his item, which is number 11, to be heard now? And if so, give me a second to ask him to join the call.
Okay.
Yes, apologies. I've asked him to join, so hopefully he should be ready to join in one moment.
No problem. It's gone fast, huh? John Joseph.
Yeah, I have emailed him, so hopefully he'll join any second now.
Thank you. Has he joined? Hello.
Hello.
Okay.
Thank you for accommodating me.
Sorry for the delay. Okay. So it's item 11.
Yeah, are you ready for me to bring the slide set up? Would you like me to walk you through the presentation on screen? Is that how you like it?
Yes, please.
Brilliant. Thank you.
Thank you.
Well, good morning, everybody. My name is Steve Trenchard. I've recently joined the CCG as interim director of transformation, working across both Telford and Wrekin and Shropshire. Prior to that, I was the programme director for the Mental Health, Learning Disabilities, Children and Young People's programme, and developed with colleagues the submission for the long-term plan. And this update is really around mental health and inequalities and some of the work that the SDP plan was looking at, both in relation to bringing online a model of trauma-informed care, but generally thinking about some of those precursors around mental health, particularly in relation to adversity. So for our system as a whole, generally we don't do very well in relation to inequalities. I'm just going to close this door, sorry. I say this because on average we lose almost 40,000 lives a year in terms of, 40,000 years of life lost per year. So if I was a chap living in this system and on the books of MPFT with a serious mental illness such as schizophrenia or psychosis, my life expectancy would be nearly 23 years less than if I was in than the general amount of my age without that condition. But if I lived down the road in Worcester or in another STP, then I would be living longer. So generally it's known nationally that the sort of average years of life lost would be around 17 to 19 years. Our system is worse and it's deteriorated as a position. Of the total number of people that are on NPFT books, we have a high level of morbidity, and we know that of the 8,000 people that are registered with NPFT, about 7% of those, which is about 7% of the population, 25% of those account for emergency attendances at SATH, 18% for all A&E attendances and 14% for all diagnostic examinations. So that small percentage of the population has a big physical health need, and that's one of the key aspirations is to combine a much greater integrated offer around mental health for people. We know generally from all of the work around adverse childhood experience, and also we've known for a long time, but I think we're getting better at articulating it, the links between deprivation and domestic abuse, alcohol and substance misuse, and trauma. And trauma, I think, is an interesting one, which if you speak to social care colleagues, they'll say we've been banging on this drum for many, many years. I think the evidence now is much clearer of the impact of trauma on brain development, on the impact of trauma on young people, and it became clear when we had the intensive support team visit into the children's services a couple of years ago for our system, that we were very quick to pathologise and point people into the doors of MPFT rather than to do something at the community level. We've been meeting, I've been chairing a group of public health colleagues that's got representation from both sides from both places, and we've spent a lot of time thinking about how we create an awareness across the system on the impact of adverse childhood experiences, particularly in later life. It's not just those early years experiences, it's the later life experience on health. And I won't run through all of the evidence, but you're probably familiar with some of the big ticket issues, which is, you're 6 times more likely if you're a girl to have a teenage pregnancy, you're 8 times more likely to end up in forensic and criminal justice pathways, you're 12 times more likely to kill yourself. Some research suggests that if you have, and it's the problem of ACE is it has a dose effect, so that the more you experience, the greater your vulnerability is. You're more likely to get cancer, respiratory, long-term conditions in later life. So all these things, having a prevention and an early access and a health promotion aspect at place, I think, is absolutely vital. So back into relation to mental health, for the long-term plan, we had 4 broad strategic ambitions. The first was around promoting good mental and physical health and preventing mental health. So this has been an interesting one. I think, if you go back and think about the old asylum models, people were basically admitted and left there for many years. In the last 10 to 15 years, nationally, we've seen 70,000 approximate reduction in beds, and mental health moved from an asylum campus-based model out into communities. We've learned a lot on that, and it was really good to hear some of the presentation previously around the rapid response team, which is effectively what we've got in the mental health patch. And I think there's lots of things that we can do to share the learning around how we develop those integrated teams. But there's absolutely still more to do, particularly at the front end in terms of how people come into services, having a really coherent and vibrant offer that encompasses health professionals from both local authority and MPFT, finance help, help with domestic abuse and violence and housing and so on and so forth. They're the sorts of things that people want help with predominantly, as well as a quick way in to therapy when it's required. And that's what we need to design in this space. One of the key things, I think, around the work that we've identified and some of the messages that came out of the consultation process, particularly from people with lived experience, and we know this from the national movement over the last 10 years in terms of recovery, is people live as social beings in their communities, and any recovery plans and personalisation plans need to happen at place. So this is really about moving the hospital away from the hospital site and into communities. I think there's something about the pathways that we've developed locally which are very specialist. So we have specialist pathways. I think there's a little bit of going back to, in line with some recent national guidance that came out, the old community mental health model, keeping the best of evidence-based practice, but absolutely locking the team into the local community. And I think there's a great opportunity for strengthening the third sector offer, working at place, working with social navigators, working with GP practices, but really locating the team, into place. Again, not at a place that's just a specialist provider. And I think the other thing was around recognising that mental health crises will and do happen, but there is a lot that you can do to prevent it. So when people and if people have crises, we want to see less, because there's more proactive care being offered earlier up the pathway, and that should be located at home where possible. The trauma-informed approach. So we've got a very clearly articulated plan for how we'd like to bring trauma-informed approach into services. When COVID hit, we stepped down the groups that were doing some of the planning, but we really wanted to ensure that we, in this time of trauma, which people are experiencing, those that have both experienced COVID, but also those who are caring for people, and those of us who watch the news and also are vicariously witnesses to what we see happening, that we wanted an approach that was based on trauma and thinking about how we support people through this. So just to say a little bit about the work that's going on in this space, what we've got is an agreement from the we identified some pennies to support a 3-year project to work on a film called Resilience, and this was a film that provides the evidence base around ACEs at population level. It's a very powerful film, but it comes with a workshop pack, and we had hoped that we would be able to share this with the Health and Wellbeing Board and actually do a workshop around this and think about how we might take this forward as a system. We've got the film for 3 years. It's digitalised, so we'll be running it in big workshops and groups and asking people to think about what actions they can take locally. An example of where this happened was in Scotland, where Nicola Sturgeon showed it to her ministers, and they ended up investing millions of pounds in a Scottish-wide trauma-informed approach, where they want all of their citizens to understand the impact of adverse childhood experiences on themselves and their children and neighbours and on their own health and well-being. So we had the bold ambition of doing something similar across our system, which has got a lot of support, a lot of buy-in. And in that group, we've got members from the police, the fire brigade, the social services, third sector. Pretty much all the partners are in the room. They're really interested in this, and there's a lot of crossover with existing system policies as well.
Sorry, Steve, I'm just a little bit mindful of the time.
Okay, sorry. So last couple of slides. At this time, there's a strong offer to develop a psychological support based on trauma. We don't want it to be just for this time. It's for a long term. And what we've developed is a model we hope to train. It says 50 here. Sorry, it should be updated. Should be 150. We hope to train 150 practitioners in an evidence-based approach to understanding trauma, to provide support and additional help to people during this period and ongoing. The base is it was developed in the forces. It's actually used by Shropshire Fire Brigade, and they've seen a great impact because of obviously the sort of adversity and trauma that they come across. And I've put some links in here for some of the work that's gone on locally, just to show a very proactive response that the colleagues in Telford have done during this period. And there's a link here for colleagues if they want some more reading around the approach for people with COVID at this time too.
Thank you very much.
On mute. There we go. Yeah, I really welcome the presentation. I think it's good that we're talking about community-based assets, helping support mental well-being. The only thing I would like to see more of is before people go into trauma-based mental health, or the low level, that we did mention social prescribing in there, and helping support people to go and do something that might improve their mental health at the low level before they go into this trauma situation. Addressing the toxic trio is key in reducing some of the mental health for children as they grow older. And we're doing all that through our holistic approach to delivering that. But I just think we just need to, at the low level, have something about social prescribing, so community-based assets are used to try and direct people away from getting into the trauma-based mental well-being.
Yeah, and that would be key to that step care model. And the trauma-based isn't necessarily about providing deep therapy. It's about normalising some of those experiences and giving people the help and guidance where they can understand some of that for themselves.
Councillor Burford.
Yes, thanks, Kelly. Thanks very much for the presentation, Steve. That's very encouraging. I mean, just a couple of points, really. I mean, there is a resource issue here, a major resource issue if we're going to take this work seriously. I'm just wondering what your thoughts are on how much we can switch to this kind of approach and accelerate this kind of approach. And secondly, we've done quite a lot of work in Telford at a locality level during COVID with the help of voluntary organisations at local level. We provided a little bit of money for them, but it's only been a little bit to help them to extend their services at the time of need. That if it's going to work effectively at neighbourhood and community level, that needs to be a major plank of this going forward. I don't see that the statutory services are going to be able to do this and achieve this effectively, and that has to be taken into account. Thank you.
Thank you. Councillor Wharton.
Yeah, just a quick one. I can justify what you've been saying, Steve, and thank you for your presentation. We had a meeting of volunteers to say thank you during National Volunteer Week, and one of the volunteers discussed how the volunteering he was doing had improved his mental health during that period of time. So thanks. I can absolutely agree with the core of what you're saying. What I would argue, though, is why isn't this part of the TWIP?
Good point.
Yeah, so it is part of the TWIP. I've attended the TWIP on a couple of occasions, and I guess just as we were getting to the point of signing off after the submission of the plan, we'd had the conversation about how do we localise some of the system plans. So folk like Stephanie and Sarah, and previously it was Clive, we're having conversations with myself, and also Tracy as well, who's heavily involved now in my team around this, about the integrated offer. I think there are just a couple of general points. The system's second to bottom nationally for mental health investment per head of population. So that's not a good place. So the system in this time of COVID, the cracks that were already there are really showing. Whilst they're predominantly talking about mental health, people with ASD and learning disabilities have really struggled in this period with lockdown, and we're seeing that, and we're very worried about that. The other thing around the investment is I'm quite clear that there is flexibility with the investment, and I've made it very clear with MPFT and others that the investment in mental health is a broad pot that's not just to boost secondary care specialist services. We need to have focus on the front end and prevention. And already I've allocated or supported the allocation of monies into some of your local services, for example, branches, as part of the calm cafes and the out of hours offer for people in crisis. And I think that needs to continue. So NHS England nationally are setting out what the sort of the broad parameters of a coherent offer would be, but it's really up to the locality to design that, which I think is very exciting. And I think why, although I work across the system, I do talk about a system-wide approach. I think the system, there's something about the what. We know what works because of the best evidence. Then the local finessing of that in terms of the how is, how your communities work and what that needs. The investment needs to fit, the broad parameters of these are the outcomes that we'd like. The how is you design the offer to meet those outcomes, and then we can test it, we can capture the data, we can get people's experiences, and we can improve it over time. And that's the model that we want to do. So it's got to be locally based, but within line with the best practice and evidence.
Thank you. Personally, as a mental health worker, I would hope to see moving forward that we don't maintain too much virtual or online mental health support. I have a concern that because it may have been a filler within the COVID-19, that as a mental health worker myself, I've used that format, but moving forward, I would like us to maintain face-to-face support, and I was just wanting to mention that, and I hope that we're not looking towards that as an option for the future.
I think it's got to be a blended mix, Kelly. You know, some people like it. The IAP model uses telephone and this sort of support. We've seen some great movements in technology with very specialist clinics, people taking their own photographs of skin lesions and speeding up the assessment and diagnostic process. I think it's, you know, rather than travel for 2 buses for an outpatient's appointment, you can do it like this with your doctor in the front room of his house. You know, with kits, you can pull up X-rays on the screen and share them. You can do all that stuff. But ultimately, we're a social being, aren't we? So we can't live the rest of our lives in this way. It will literally drive us quite mad. I think the face-to-face bit is really important. I think it's got to be a blended offer.
Yeah. Right, thank you very much. Thank you so much.
Nice to pop in. Hope you keep well, everybody, and see you again soon.
Thank you, and you.
Bye-bye.
Okay, thank you. So last item, sorry, I am aware that we've run over, but if everybody's okay, we've got one item. Item agenda 10, it's Helen Onions on the domestic abuse progress report.
Hello, it's good afternoon now. I've got Stacey Norwood with me here today. We presented an update on the domestic abuse strategy implementation in February, but it's been a key focus during the COVID-19 pandemic, so we wanted to update you on some of the progress to the strategy and also that context. So I've just got one overview slide there with me. Okay, can you see that okay? Yeah. So yes, we have had a particular focus in the last few months at the Council's internal SMT Gold command meeting, and also at the tactical coordinating group with police, NHS and partners. In terms of the numbers of recorded crimes and incidents that we hear from the police, we haven't actually seen an increase compared to the same period last year. But certainly what we learned from China and from other countries that were further ahead than us in the pandemic curve is we do expect to see more disclosure of domestic abuse as our lockdown lifts. So we'll be keeping a close eye on that. Just in terms of a short-term response through the pandemic, we committed some additional funding from the council to support the live chat service that West Mercia Women's Aid run, and also expansion of some of the funding to Shropshire Domestic Abuse Service to support people one-to-one, but also for their helpline. We've also done some campaign work based on the national campaign, You're Not Alone. We've refreshed our web pages, signposting, publicising support. We have a video from the Shropshire Domestic Abuse Service, and have had a social media call to action around the palm and in the heart of your hand, recognising the issue. I'm very keen to publicise and signpost some of our services in supermarkets and in NHS places when it was part of the lockdown, and where victims were likely to see information because they were going out to those places. So overall, we just wanted you to have recognition that we had a particular focus during the pandemic on domestic abuse. It does connect, as Steve mentioned, to the adversity agenda, and it connects well to our health and wellbeing strategy as well. And we've been continuing to implement our plan. The very positive news for the future is that we've identified funding within the council to develop our family and perpetrator programme, and also to enhance the support to victims and their families affected by domestic abuse, and some of the in-accommodation support for victims, which links to the domestic abuse bill. So that's very positive in terms of us going forward. So I'll just open it out for any questions.
Thank you. Councillor Overton.
Yeah, it's just a comment, really. I mean, I'm really proud of what we're doing in relation to domestic abuse. Now we're trying to reduce that, and the support that we're offering and the funding that we gave out during COVID, as well as the funding we've identified to do the family and perpetrator programme, as a try and deliver that. I mean, I am, as Helen says, I am worried that although the reporting of domestic abuse has gone down, when Refuge has the most visits to its website reported, but there is going to be a rise in this once we come out of lockdown. I believe that there'll be a lot of reporting, and the support that we put in place for this council's through partner agencies and what we've got on offer, I think we'll be able to help those people. But depending on the rise, then I think it's something the government may have to look at funding across the country, really, because I think lockdown has caused this to be a bigger issue, and people can't escape from that, really.
Councillor Reynolds.
Thank you, Chair. I think I'm really echoing partly what Councillor Overton's just said. I think the issue really is, once lockdown eases, my concern is, do we have the capacity in place to cope with the increased rise in numbers that we're going to have? Obviously, I do hope that people come forward, male, female, if there's domestic abuse going on. We do want that to come forward, but it's a whole family issue. I'm also concerned about the young children hopefully going back to school in the autumn. Then I think they will start to disclose things, and it's making sure we have got that wraparound support care for all of the family, because domestic abuse affects everybody of all ages in a family. I like the fact you've done your campaign. We've done very similar thing with Children's Services with a Don't Sit in Silence campaign, and I think as much as we can all do to promote that, it is going to be difficult for some people during COVID to actually reach out for support. So I do worry that our numbers maybe are artificially reflecting less usage because people haven't been able to get out and report it. So it's about us being ready in September, autumn, that we can help with our partner agencies. This isn't a job we can do on our own. And I echo actually what Richard has just said. I think this is going to need government funding across the country, because I think this is going to be everywhere. We're going to get a rise in cases come autumn. But, I know we will do everything we can as a council to support the families. Thank you.
Thanks, Shirley. I don't know if Stacey might want to come in, but we're quite ready to start our commissioning arrangements around the enhanced support and the perpetrator programme, but we hope to start that fairly quickly because we have already got a service model scoped up, haven't we, Stacey?
Yes, and also recognising the work with schools. So again, a conversation with Sean Dean yesterday regarding a package for schools so they can also support individuals when they return back to school.
That's really good to hear.
Tomlinson.
Thank you very much, Chair. I think being last, most of the things have actually been mentioned. I'm glad that we have got the funding, but as Councillor Reynolds has said, it may not be enough funding, because I'm sure there will be a spike in the numbers whenever this is over. It is a worry. There are a lot of stress and strains on families all being together, not being able to get out. I think it obviously exacerbates the situation more. It's great we have got the signposting, but as you know, majority of signposting that does work is in the toilets. Can't use the public toilets. So if you are with an abusive partner, whether it be male or female, you can't get away from them to go to the toilet to actually make that call. So, I can see why it hasn't spiked at the moment. It is a worry. And I do think it will be huge. I'm sure it will be. And as Councillor Reynolds said, I think we will need more funding to be able to deal with all this, because, obviously the hospitals are inundated with COVID-19 patients. I think it's going to be the same when this is all over with domestic violence. And also the fact that, as Councillor Reynolds says, the children aren't at school, so they're not reporting anything to their teachers. So again, it's a missed opportunity there, and it does affect the whole family, not just the adults but the children as well, and it's really important that we have enough funding to be able to cater for this when it eventually hits us. Thank you very much.
Councillor Watson, you had your hand up and then put it down, did you?
Yeah, Kelly, my point's been made. Thank you.
All right, thank you. Right, that's it.
Okay.
That's the end of the meeting. Thank you very much. The next meeting is scheduled for 10th of September at 2 p.m. So thank you all very much.
Thanks, Kelly. Well done.
Thanks, Chair.
Thank you very much. Thank you, everybody.
Well done, Kelly.
Thank you, Kelly.
Bye-bye.
Bye.
Thank you, Joe. Bye, Joe.
Bye.